Hi, my name is Bruno Bobato. I'm speaking from Brazil. We are going to present 3D imaging and virtual reality for shoulder surgery. I have no disclosure for this presentation, and this was made on ICSIS 2019 in Buenos Aires. The objective of the next few minutes is to introduce you the new 3D technologies and show in a very practical way how 3D planning and 3D images can have a role in our lives, in our shoulder surgery lives. This is a quote, and it's important to understand that the 3D tech is the materialization of the surgeon's plan. So we have an example here of a 3D printed clavicle model. Here we have example the digital model, the 3D digital model, and the digital plan. And the most important thing about 3D tech is that it materializes or digitalizes in the digital world the surgeon's plan. The 3D printing, the guides, it does not operate the surgeon, it does not do the surgery for the surgeon. It's just the digitalization of our surgeon's plan. And here we have some examples that we can use for a simple case like clavicle fractures. This is one of our cases. We are using 3D printing and 3D planning to help us identify the fragments and plan the surgery. Here we have printed the model originally, and we have printed the same model removing the intermediate fragments and already with the location of the screws, because now we can replicate our planning that we have done in our computer directly during the surgery using the models. And here we can see how we have the planning, the surgery, the location of the screws, and the 3D printed model originally, the original model, how we will encounter during the surgery, and how we plan to fix it in our surgery in a very simple way. Here we have developed some guides that will help us position the location of the screw in the correct position. And this is our example for clavicle fracture. We know that shoulder arthroplasty is the best indication for using 3D planning and 3D guides. We know this can be a challenge procedure. And here we have some examples of a very simple scapula, a very simple glenoid. This patient has no problem. And if we plan to place the implant in the middle of the glenoid, we will have no problem. The implant, the reverse total shoulder, the base plate will be placed in the best fitting position, the best fitting in the best stable position, in the best anatomical position for the patient. And this is what we are going to achieve if we choose placing this implant very in the middle, as we have learned in the past. The implant is placed in the very good position in the very middle of the glenoid. But we are not all the same. Sometimes we encounter some difficulties. Sometimes we have some retroverted glenoid. Sometimes we have very inclination glenoid, as we can see here in these 3D printed models. And sometimes we have very bad glenoids, bad and very bad glenoids, as we can see in these two 3D printed models we have done some time ago. Sometimes we can see a relative normal glenoid, as we can see here in all the views. And sometimes if we choose to place the implant in the normal central position, we may have encountered some errors. Seeing this plan, we can see no problem, but when we turn to the posterior position, we see that this implant is not in the correct position, not more stable position, at risk of fracturing the posterior part of the glenoid. And sometimes we think that the middle is the correct position, but in this case, probably the correct position for this implant is a little bit anteriorly. And who would think that the best position for this implant, or the best stable position for this implant, would be just like that I'm showing you in this presentation? Who would place the central pin guide for this implant in this position if we have not planned and we have not used the digital road, the digital model to plan our surgery. That is a lesson that I want you to bring at home. You can develop, and we can develop, our own guides for every surgery. Here is some examples of the glenoid guides for patient-specific guides, other versions, other types of guides that we can use 3D print at home or at your facility, at your hospital. You can develop your guides using simple software. Another example. And we can also plan our graft. This is a retroverted glenoid that we have planned the graft. Here is the example of our planning, our software, our CAD software. It's a regular CAD software, no company related, and the planning of the graft to place the implant in the correct position. Here is another example of our developing a patient-specific guide using a regular software, the location of the pin and the guide that we have created. And here is the guide printed, 3D printed in a resin 3D printer, and another example of how can we use 3D printing for help us during our surgery. Here we can see a Latarjet procedure planning. We develop our planning for, we understand that the Latarjet or the Bristol procedure is a shoulder osteotomy, so we plan as should be. So we use the CT scan to understand the patient's anatomy. We plan the position of our graft, and we 3D print. Here we can have an example of the glenoid that we will encounter with the fragment, and the same glenoid we have removed the fragment, and we have printed using just the location of the two screws, that we can have this 3D printed model at our operated site, at our surgical field, to replicate our planning. Other option is to use patient-specific instruments. This is a patient-specific instrument. It's a coracoid guide that we have created. You can see here it's just like a plier, very simple plier, and a patient-specific guide for the glenoid position of the screws that can be developed very easy in any kind software. This is a elbow example. This is a proof of concept of a cubitus varus elbow, and we can have here, we can see this patient have 20 degrees of varum, 15 degrees of extension deformity, and 10 degrees of internal rotation deformity. We use the 3D printing trying to understand this deformity, as we can see, and we can plan the surgery, the correct osteotomy, using regular software, and develop our own patient-specific guides to help correct this position, to help to correct this elbow. Here is the example of the planning of the ostomy and the final guide. Here we can see the 3D printed models of the guide, the 3D printed models of the osteotomy, and the correction of the screws. Here's another example for a proximal humeral fracture. We have planned the surgery, as you can see here. Here you can see the deformity. We have planned the surgery using some guides. And here we can see our virtual reality, using augmented reality, using a simple piece of paper and our phone. We can see the planning of a clavicle fracture and the planning of a shoulder arthroplasty, and using a very simple patient augmented reality device that we can see here, our planning. The patient has a proximal shoulder fracture, and the planning of this fixing with a locket plate. Here is our planning, and here is the augmented reality that we can have during our surgery. Here we are using a Microsoft HoloLens. This is a augmented reality glass. We can see we 3D printing this fracture, and we can see here's me with the glass, and here we can see the planning placed virtually, the deformity, the fracture, and the planning of the surgery, how we can achieve this during surgery. We can use other softwares in virtual reality. Here we have imported the Blueprint software into our mixed reality glass, any software can be imported with some very simple tweaks to our virtual reality. And here we're using HoloLens during a surgery, during a reversed total shoulder arthroplasty. Then we can see here the planning of the surgery. This is a very deformed glenoid with a very great inclination and great head reversion. And here we are using augmented reality and 3D printing to help fixing this case. Thank you very much.